First, live, local. This is Fox 12 Now.
Welcome back to Fox 12 Now. I'm Greg Nibbler. We are live streaming here from the Fox 12 Oregon newsroom every weekday starting around 1 p.m., going throughout the afternoon whenever there is breaking news. I just want to let you know this is a place to go. We'll be on YouTube, we'll be on KPTV.com, under the Fox 12 Now tab, or of course the Fox 12 Oregon app. Anything outside of our normal newscasts, this is where to go. But we also have a number of different segments and interviews and topics that we cover here in a wide range, and one of those is what we're going to be discussing here today, which has to do with mental and behavioral health care workers. And the workforce is apparently not very well supplied right now. And so there is a possible solution to that, a bipartisan bill in part proposed by U.S. Congresswoman Andrea Salinas. It would provide funds for those who would be entering into that field. So while they're in college, there are stipulations that go along with it. And we discuss what this bill would mean for both since it is bipartisan, but also for all of those people who are lacking health care, maybe areas where there is not much of a supply, maybe where there's not enough workers to handle some of the needs that are there. So we discussed that, so let's go ahead and jump right into it. Here is Congresswoman Andrea Salinas discussing the bill. All right, well, Congresswoman, thank you very much for joining us here today to talk about this. And, obviously mental and behavioral health issues are something that is on the mind of a lot of people. It's well recognized as a major issue in this country and probably beyond that. But this bipartisan bill in particular is aimed to increase those people that can help with some of those things as far as the workforce. Can you give us just the basic rundown of what this bill would do to help address some of those issues?
Yeah, thank you. So as you mentioned, Greg, people are really struggling right now. In fact, 1 in 5 Americans currently struggle with mental illness, yet the majority aren't able to receive any treatment. And the same is true for Americans with substance use disorders. About 93% of folks with an SUD do not get treatment. So this lack of available providers really spurred me to do something about it. And so it got me thinking, why not be able to grow the workforce and make sure that we have trained providers with cultural and language abilities and address some of our populations that don't have any providers, especially our rural areas. And why don't we also start to grow that workforce by providing some scholarships to students who want to get their degrees? For me, when I was back in undergrad, I thought I would be a clinician. And when I graduated without any debt, I thought, my goodness, this is going to be a hefty cost to me. So a lot of folks who want to go into the field into, counseling or social work, it's expensive. So a lot of masters in social work graduates basically graduate with about $67,000 in debt. And for psychology degrees, it's even higher, anywhere from about $95,000 to $160,000. So it got me thinking, let's try to help these folks who want to go into this. It's not an easy training program. It's not easy to get those degrees, and it's expensive. So essentially what the bill does, it's a bipartisan bill that creates a new scholarship program through the Health and Human Services for students in the mental health, behavioral health, or substance use disorder prevention professions.
And these are specifically going to be targeting some of those underrepresented communities.
That's right. So specifically, this bill prioritizes students from groups that are currently underrepresented in the workforce, and also areas where there's a provider shortage or a higher than average overdose rate after these folks graduate. So it'll ensure that providers are going to work in the places with the most need, including some of, as I mentioned, our underserved rural areas.
Underserved rural areas, excuse me. So when you talk about that for the underserved rural areas, which is particularly, definitely a concern, how would that go about? Obviously we would have some more people being able to graduate, but are there ways for them to reach those rural people? Are there positions and jobs available for them once they did graduate to actually be able to interact with some of those people who aren't represented as well?
Oh, yes, there are definitely areas where folks can start to fill into the workforce pipeline. We have, community mental health spaces. We have all kinds of different private clinicians. And I'm talking to a lot of those folks out in Woodburn, in Yamhill County, in Polk County. And what I consistently hear, though, is while you may have the physical structural space, they don't have the providers. And so that this is a huge area where I think we can start to fill in. And as we're seeing folks who really want to go into this work, and we're seeing a need for it, especially post Measure 110, where we know substance use disorder is a big part of what we're seeing with this. We need these providers.
And, as we're seeing a lot of these issues, and as you mentioned, people who are not being served, and this is all across the board, those numbers are pretty staggering, actually. 93%, I think is what you mentioned, are not seeking or being able to or seeking treatment. What would be some of the ways to reach them as well, to let them know that there are services that are available? Once these jobs do come in and these positions are being filled, how would you then reach out to that 93% to get them in some percentage in for help?
So a lot of again, community-based health centers is a great way. So the more local, the better it is in my mind, right? And so a lot of times it could be at a school-based health center where they also have mental health providers as well. So meeting people where they are is typically a good place to start. There are also different organizations within the community that offer peer services and other types of services, but anybody who is above a graduate degree level will be able to fill in to these different community-based organizations, essentially to provide that. So really, it would be through different community outlets, community outreach, essentially.
And going back to the bipartisan bill, which would, provide some of the scholarship funds, can you give us just a little bit more detail? You mentioned it briefly, but how the funds will be paid for and how that scholarship would actually work for those that would apply for it.
Yeah, so it would be a direct appropriation from, the government. The bill itself doesn't give the appropriation, but it authorizes about $75 million per year for, like I said, an agency, a department through HHS, Health and Human Services, to award to individual students. And so students would have to essentially fulfill their obligation in a mental health shortage area or an area where the mean drug overdose rate exceeds the national average. The bill also includes some provisions to recuperate funds from students who may not fulfill those obligations. And again, it would be up to the Health and Human Services to come up with a rule that would prioritize students from either groups or underserved areas or populations that are underrepresented in the behavioral health, mental health, substance use workforce.
So, okay, so there would be stipulations, that they have to serve in those certain areas and communities. Looking at the bill, as you mentioned, bipartisan, which is pretty big, especially for right now. Obviously, a lot of division, an election year, all of that. We all know what's going on there. But when it comes to that bipartisan side and having this bill go through, what are the chances, do you think, of this passing? What are the next steps of this actually making it through?
Well, as you probably know, we have just a few days until we fulfill our obligations to fund the federal government, and we should be doing that later today. And then Congress is probably out until after the election, and then we come back for a lame duck session. So this year, I don't think that we will end up passing anything really, but this is just the start. I've talked to my co-lead on this bill in particular, Mark Molinaro from New York, and he has agreed actually to be the co-chair of the Mental Health Caucus with me. And I think we're both very serious. And we actually had a conversation on the floor about our seriousness around this issue. And I said, it's not partisan for me. This is about really moving people forward. I think I've talked about it, but I've had, my own family members with mental health problems in the past. And so it's personal. And I think it's personal for Mr. Molinaro as well. And so we are sincere in trying to co-lead both of our caucuses to get something done. And the workforce is obviously one of the best places to start because people cannot access care unless we have those providers. So while we may be laying the groundwork today and through this current session, I'm hoping no matter who is in control next time around, that we come back as a bipartisan force and continue that work next year.
Well, obviously something that definitely needs to be addressed in so many different ways. And I think going back to what you said with that statistic, 1 in 5 Americans. So that's not a partisan issue, as you mentioned. There's no demographics that apply to that. That's everybody. So
that's right.
Yeah, clearly important work, and we'll hope to see here in the new year what can get passed with that. But obviously, it's a start. So, Congresswoman, thank you very much for joining us. Anything else that you think is important for people to know about this?
No, just that I recognize that, it's expensive to get these degrees, but we need folks on the ground. And like you said, not just in Oregon, it's across the United States. So thank you so much for addressing this.
Thanks for joining us. Really appreciate it. Okay, all right. I cut off the very end there, but definitely an interesting proposal there to help fill in some of those gaps when it comes to that workforce, especially for mental and behavioral health care. We are Fox 12 Now, so thank you very much for being a part of this, for joining us here on the show. We're live from the Fox 12 Oregon newsroom. Thank you to Representative Andrea Salinas for joining us for that segment and discussing that bipartisan proposal. If you have a suggestion for a segment, feel free to reach out and send me an email, fox12now@kptv.com. You can check out all of our segments at the Fox 12 Oregon YouTube channel, of course, kptv.com under the Fox 12 Now tab, or you can always download the app for whatever device you have, and that's a great way to catch all of our programming and everything else that we have here from Fox 12 Oregon, which is a lot. I realize that, but we encourage you to check out the Fox 12 Now content as well. We will be here if there's breaking news anytime between 1 p.m. and 4 p.m., so if there is, I will talk to you then. But for now, I'm signing off. I'm Greg Nibbler. This is Fox 12 Now.